안녕하십니까.
So good afternoon, ladies and gentlemen. I am Kim Sangcheol. I am the president of Seoul Welfare Foundation. I would like to first say that it is a great honor to deliver a presentation about SSIP, which is the first of its kind in terms of a welfare system. So today I'm going to talk about the overview of the SSIP and results of the baseline survey, and here is the outline of my presentation. First, I'm going to introduce SSIP briefly, and then I'm going to talk about the implementation of SSIP, and then I will talk about the research design and of SSIP, as well as the baseline survey plan and results. And I'm also going to talk about the categorization and characteristics of SSIP treatment group. And last but not least, I will talk about the future plan of SSIP. So SSIP randomly selected 500 households whose income is at or below 50% of the standard median income and whose asset value does not exceed 326 million Korean won. So the randomly sampled according to the statistical criteria designed to ensure that the group accurately represents the households of diverse size and ages. And so we have 500 households, and then the control group we have 1,000 households. So in recruiting the participation for SSIP, 33,000 households applied, and then we selected treatment group. And from July of this year, they are receiving the payroll. For the control group, it's 1,030 households, and they don't receive the safety income, but they will take part in the interim review and investigation. So the research design of SSIP, we have a treatment group, and then through pre and post, there will be pre and post research, and then also we have treatment group and control group, and then every 6 months, for all of the households that are participating, we will carry out an interim research. And after the project concludes, we will carry out ex post analysis. And after 1 year, we will also carry up a follow-up phase. From 2022 to 2025, for 3 consecutive years, we will provide SSIP, and the research will be carried out for 5 years until 2026 because we will be continue to observing the participating households. In order to find out the income of these participating households, there are 7 sectors that we look at. First is work and employment. Second is financial conditions and outcomes, education and training, housing, health, family, and social relationship, as well as life satisfaction. And there are 150 questions. So with these 150 questions, we are able to understand the different characteristics and changes of the participating households. Here is the result of the baseline survey. So it is based on the features of the household. So if you look at male and female, you can compare the treatment group and control group, and you can see that the majority of households is led by female. And you can see that for the treatment group, it's 54 years, and for control group, it's 50.2 years. And treatment group and control group number of household members is 2. And you can see that in terms of education level for treatment group and control group, it is similar. So here, through these numbers or these indicators, you can see that there is a lot of similarity between treatment group and control group. And now I would like to delve into each of the different categories. The first category is work and employment. So for treatment group, it was 48.1%, and for control group, 45% had a job. And you can see that for both groups, they worked for more than 40 hours a week. If you look at for the households that did not have a job, they talked about how their business was not doing well, or that they had temporary illness and accident. So you can see that business not doing well was 44.3%, temporary illness and accident was 26.2%. And for those who were doing job searching for treatment group, it was 18.8%, and for control group, it was 20.1%. Next, we look at the financial status. And so for treatment group, it's 1.39 million won. For control group, it was 1.46 million. And you can see monthly expenditure was 1.75 million won for treatment group and for 1.66 million for control group. So if you look at for debts, you can see that for treatment group, it was 50.8%, and for control group, it was 60.2%. So it was a little bit higher for the control group. So here you can also see property and debt, 84.85 million for treatment group, and control group, 82.56 million won. And for debt, it's 73.21 million won for treatment group and 67.78 million for control group. For housing, you can see the majority of participants were paying monthly rent. And they felt that heating and cooling cost was quite a lot. And you can see that of the respondents, about 12% lived in basement or semi-basement housing. So they were living in non-residential buildings. And 52 households, about 3.4%, were living in non-residential buildings. And next is health and life, and you can see subjective assessment of physical condition. You can say that those that said low was for treatment group 52.1% and control group 53.5%. So majority of them actually had chronic disease, and majority of them felt that they were not in a good physical condition. And you can see the morbidity rate was relatively high. And in terms of happiness, you can see that there is higher percentage of people who felt dissatisfied with their lives. And we try to categorize the different households. So we look at work and income. So the median income was 30%. And so we looked at absolute poverty and relative poverty, and the criteria was 30% of standard median income. And we were able to derive 4 groups. So those who were absolute poverty and work, and those who had relative poverty and work, there were the main groups. And so also we can divide it with young household and middle and old age household. And what we found was that we also saw if they had spouses or not. And so for the absolute poverty and no work, we saw that there were middle and old age households and had high risk of poverty because of dual risk, which is no work and poor health. And then next we look at income and net asset and looked at the different groups. I think the group that we're most interested in is those in the absolute poverty and negative net asset, as well as relative poverty and negative net asset. For the absolute poverty and negative net asset, there are young age householders with financial vulnerability, and in this group, we saw that there was more debt than asset. There was low motivation to work, and they were financially very vulnerable because a lot of them had temporary employment. If you look at relative poverty and negative net asset, there were middle-aged householders having a high risk of poverty entry. So in this group, they had a lot of jobs, but they were self-employed, and a lot of them did not actually own homes. So now we looked at income and social isolation, and there are 4 different categories, and the key groups here are the absolute poverty and low isolation level, and absolute poverty and high isolation level. So these 2 groups. So in the absolute poverty and low isolation level, there are non-working young and middle-aged householders having risk of social isolation. And in this group, they were not working, so they were economically very vulnerable. And because they were aging, there was the possibility that there would be more social isolation. For absolute poverty and high isolation level, we felt that they were facing multidimensional risk, and there were middle-aged householders. So there were economic and health factors that were having a detrimental impact on their level of economic stability, meaning that they were more prone to poverty. Next, we looked at income and plan, and we categorized the participants. There are 4 categories: in absolute poverty and having a new plan, absolute poverty and not having a new plan. So these 2 groups are groups that we are interested in. So in the absolute poverty and having a new plan group, there are young age householders who have the possibility of moving out of poverty. In this phase, they don't work a lot, but they are very active in searching for jobs. And so in this young age householders, I believe that safety income will provide them with a new opportunity and also help them to take part in the labor market. Next is the absolute poverty and not having a new plan group. And these are middle and old age householders with a high risk of persistent poverty. You can see that they don't really look for jobs, and also the employment rate is also low. Next, we look at income and health, and we categorize the participants. So we have absolute poverty, having poor health, and relatively poverty and having poor health family. So for absolute poverty and having poor health family and relative poverty and having poor health family, these are the two groups that we would like to focus on. In the absolute poverty and having poor health family group, there are old age householders with a high risk of persistent poverty because of health problems. And this group, they don't have high employment, they have high medical bills. In the relative poverty and having poor health family, because of health, there is the possibility that they will enter into poverty, and they are middle-aged householders. They have a low level of depression, and they are working, but because of their health issues, their income might go down, and this will push them into poverty. So if they get safety income, they will be able to address the issue that they are facing right now in terms of health and economic stability. Next is the future plan of SSIP. So initially, we were looking at households whose income was at or below 50% of the standard median income, or 30 households whose income is between 50% and 85% of the standard median income. But in the future, we will add 500 households with 50% of the at or below 50% of the standard median income. So we will provide safety income to 1,600 households, and also the control group will be expanded, and it will include 3,200 households. So through this research, the results that we derive can be generalized if we have more households participating in SSIP. So for the smooth operation of SSIP and to derive quality research results, Seoul Metropolitan City will do its best. So we look forward to your active interest and support. Thank you very much for your